Do you have women coming in to you who have pain associated with their menstrual cycle? That obviously must be pretty painful if they're coming to see a naturopathic doctor.
Mm-hmm.
Is there something you can do that they can't do themselves and that a conventional doctor can't do for them?
Mm-hmm. So we call that technically dysmenorrhea or painful menses, and menstrual health issues is probably one of the number one or very top five reasons why a patient would come see a naturopathic doctor.
Mm-hmm.
So again, as a naturopathic doctor, we're in a good position to be able to provide a wide range of therapies. And I have been doing this for 15 years, so I've got to see what works and what doesn't work.
Mm-hmm.
And so what I find is that if we work on often strengthening the uterus through herbs, raspberry leaf, for instance, is a wonderful tonic, and sometimes other herbs, depending on their other symptoms, as well as giving their body the right nutrients. So, for instance, sometimes the reason for the painful menses is that there may be excess estrogen in the system, or that their hormones are dysregulated or imbalanced. So we have to look again at the root cause. So we might look at whether we need to support the liver to function more optimally. So we can use nutrients and herbs that way. And now the mind abdominal therapy is this wonderful added component. So once you've addressed potentially the liver, or you've made sure that they're giving them the tonics to strengthen the uterus and maybe improve their nutrition, cleaned up their diet, manage stress more effectively, then we can start to do this massage, which in itself, again, it decongests the pelvic area. It improves the tone of the uterus, the position of the uterus, allowing it to function more optimally and empty more properly. And so women start to have less pain. They notice changes in, less clotting of the blood, less painful signs that we associate with painful menses. And it's really exciting to see that, because once their menstrual cycle is healthier, it generally means that their whole body is healthier. It's a sign of good health.
Is it something you can often help fairly quickly, like in the course of a few cycles, or does it depend?
Yeah, I would say a few cycles is a good target or a good range to look at, because we only menstruate once a month. We are waiting to see what that one cycle is like. So we have, essentially 3.5 or 4 weeks every month to get the treatment going. And then we get to see what the result is. So usually 2 to 3 cycles in, we start to see changes. And every case is different. But yes, typically most patients start to see a difference. And again, it depends on their level of engagement and how much self-care they're willing to do, and how quickly their body responds as well.
Okay.